Hi, I'm Vanessa, one of your youth peer educators. Today, in this series of sexually transmitted and blood-borne infections, we'll be talking about hepatitis B virus, or HBV. This video will cover 1. What is HBV? 2. How is HBV transmitted? 3. What are the symptoms of HBV? 4. How do you test and treat HBV? And 5. How can HBV be prevented? What is HBV? HBV is a viral infection of the liver that can range from acute to chronic. Acute infection is within the first 6 months of getting the infection, and chronic infection is when an individual has the virus for longer than 6 months after getting the infection. Many individuals clear the virus, but some go on to develop chronic lifelong infection, including long-term health issues such as liver damage, liver failure, and even liver cancer. How is HBV transmitted? HBV is mainly transmitted through the blood and bodily fluids of a person with HBV. For example, coming into contact with bodily fluids of a person with HBV during sexual contact. It can also be transmitted by sharing drug-injecting equipment such as needles and syringes. It can also be transmitted through vertical transmission, which happens when a childbearing person with HBV gives birth and the virus is transmitted to their infant. What are the symptoms of HBV? The Nova Scotia Communicable Diseases Manual states that initial infection with HBV may be asymptomatic in up to 50% of adults and up to 90% of children. If there are symptoms, they can include fever, fatigue, loss of appetite, nausea and/or vomiting, abdominal pain, stool that is pale in color, joint pain, and jaundice. How do you test for HBV? The only way to test for HBV is through blood testing. A specific set of blood tests is conducted to show the presence of the virus and the body's immune response. How is HBV treated? Well, the main thing to remember with HBV is that there is no cure. However, for acute HBV, rest, adequate nutrition, and fluids are recommended, as well as support if needed. For chronic HBV, specific antiviral medications can be prescribed, and support is also recommended. How can HBV be prevented? HBV can be prevented through abstinence, using condoms when having sex, not sharing drug injection equipment, vaccination, which is typically given as a series of doses over a specified period of time, and getting both yourself and your partner tested. The publication of this video has been made possible through financial contribution by the Public Health Agency of Canada. Thanks so much for watching. We hope our video series helped you to better understand sexually transmitted and blood-borne infections. Don't forget to check out our pop quiz video and test yourself on what you've learned throughout the series.